and Assalamualaikum. Welcome back to my YouTube channel, and today I will do a simple presentation on how the coronavirus spread inside an aircraft cabin. But first of all, let me tell you a little bit about myself. My name is Nur Anissa binti Sahadi, and I am a first year student taking up Bachelor of Science specifically in Food Technology in University Television on Malaysia. So, what is coronavirus? Coronavirus disease, also known as COVID-19, is an infectious disease caused by the SARS-CoV-2 virus. Most patients infected with the virus will have mild to severe respiratory sickness and will recover without needing any specific therapy. Some, though, will get very ill and require medical treatment. People over the age of 65, as well as those with underlying medical disorders such as cardiovascular disease, diabetes, chronic respiratory disease, or cancer, are at a higher risk of developing serious illness. Anyone of any age can become very ill or die as a result of COVID-19. People with COVID-19 have a large variety of symptoms ranging by starting from gentle symptoms to severe illness. Symptoms could seem 2 to 14 days once exposure to the virus. Anyone will have mild to severe symptoms. Those with these symptoms equivalent to fever or chills, cough, shortness of breath or problem breathing, fatigue, muscle or body aches, headache, the loss of sight or smell, sore throat, congestion or fluid noise, nausea or vomiting may have COVID-19. Moving to the next point, how does COVID-19 spread? When an infected person coughs, sneezes, speaks, sings or breathes, the virus can spread in microscopic liquid particles from their mouth or nose. These particles range in size from big respiratory droplets to tiny aerosol. If you feel ill, it is critical to adopt respiratory etiquette, such as coughing into a flexed elbow and to stay at home and self-isolate until you recover. In relation to the main topic, how does COVID-19 spread inside an aircraft cabin? A case law, which is Boyle's law, is applied. According to Boyle's law, increasing the amount of space available allows gas to spread wider apart, but this reduces the number of or quantity of particles that contact the container, causing the pressure to fall. As the capacity of the container decreases, the gas particles clash more frequently, increasing the pressure. For example, while filling the tire with air, the gas molecules are packed together, limiting the capacity. As a result, as long as the temperature remains constant, the pressure rises. When the pressure within the cabin rises during the flight, the outflow valve closes. When the cabin temperature is nearly steady, the effect of air circulation is enhanced since the cabin environmental control system are also operating. The air enters the cabin from above and flows downhill toward the floor. This air enters and exits the cabin from the same or surrounding seat rows. The air between rows travels slowly, lowering the chance of respiratory pollutants spreading between rows. However, if someone in the cabin coughs, a large number of droplets will be disseminated. SARS-CoV-2 droplets in a crowded setting can disrupt local airflow and move in both directions at the site of escape. When exposed to window regions, little drops containing the virus may go further. Unfortunately, intricate circulation patterns are created, which can transmit the infection to other passengers several miles away. droplets make a 4 to 5 feet forward during forceful expansion, and the aerosol cloud may travel much further because the velocity is around 10 meters per second. Cloud droplets are carried higher by the airflow arrangement of most commercial jets before traveling horizontally through the cabin. Because longitudinal airflow is small in the same row as a person, getting those droplets is far more risky than if you sat in a different row. All these folks around the traveler are at high risk. Those mobile cough droplets will move even farther down the cabin if another passenger walks by the individual that covered. Air movement created by the walker can carry the droplets right down to a totally completely different part of the plane. After you walk around, there is a break to induce the sickness. Otherwise, you won't latch on. However, you would possibly bring it to your fellow passengers. And to get matters worse, cough droplets can land on all the surfaces we have a tendency to touch. Those droplets didn't attend you directly. Probably simply go to the receptacle table, armrest, even headrest, or the seat back ahead of you. Furthermore, to prevent the spread of COVID-19, there are few steps that we have to follow. First, maintain a safe distance from others, at least 1 meter, even if they don't appear to be sick. Second, wear a mask in public, especially indoors or when physically distancing is not possible. Third, choose open, well-ventilated spaces over closed ones. Open a window if indoors. Fourth, cleanse your hands often. Use soap and water or an alcohol-based hand rub. Fifth, get vaccinated when it's your turn. Follow local guidance about vaccination. Sixth, cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. And most important, stay at home if you feel unwell. And that's all from me for today. Thank you for watching.